Hello friends, let us now learn some important side effects of bedside radiograph. So, what is bedside radiograph? What is one of the disadvantage actually? Normally, if you see, either you do a PA view or AP chest X-rays. In both these, the dome of the diaphragm is well defined. The dome of the diaphragm is good actually, it is clearly visible. I'll show you the X-rays of both AP and PA views also. So in both AP and PA view, you see that the domes of the diaphragm are well defined. But if this dome of the diaphragm is obliterated, if in any X-ray, if you see that this dome of diaphragm is obliterated, not clear, then you should always suspect that there is a lower lung disease, lower lobe disease. So if this dome of diaphragm is normally seen, but if it is obliterated in any case, then you should always suspect that there is disease in this part of the lung. That is nothing but there is some disease in the lower lobe of the lung. There is some disease should be suspected in lower lobe of the lung. Okay, but but there is one exception. That is if normally, if the patient is in bedside radiograph, if the patient is sleeping like this, okay, if this is the machine and if the light falls, it should fall perpendicular to the patient. So this beam which is released from the X-ray, that is X-ray beam, should be perpendicular to the patient. But if it is a bedside radiograph, the distance between this X-ray machine and the patient is very less. So obviously the beam which falls, it falls at an angle. See, this is falling at an angle rather than being perpendicular. It is actually falling at an angle. Now, now here there is angulated beam. That is angulation is seen. Okay. The beam is angled upwards. So because the beam is angled upwards, this angulation can result in ill-defined left lobe of the diaphragm. The left dome of the diaphragm may be ill-defined, and this may be misdiagnosed as lower lobe disease. So always keep in mind that if you take a bedside radiograph and if these domes of the diaphragm are not clear, then it might be due to the angulation of the beams passing through this to the patient. So as a result, we should ask the patient to repeat the chest X-ray in this situation. Thank you.